Well, hey there, Myo family, and welcome to this episode of the Myo Minute. It is sure to be an eye-opener for some people who are questioning their mouth guard. But first, let me introduce myself. My name is Carmen Woodland. I'm an orofacial myofunctional therapist at Impact Myofunctional Therapy, which is a large global myofunctional therapy practice. I specialize in working with clients on breathing, we do tongue tie prep. I do a lot of digestive work because a lot of my myofunctional impairment clients have digestive issues because of their breathing, their tongue posture, their tongue thrust, their fight or flight. But I also am a nutritional therapy practitioner, so I also work with clients on the inside of that, working on digestion and improving that so that they get an overall improvement in their wellness. Like I said, I see all my clients online. So in this episode, I am going to be talking about mouth guards, okay? Now, I tend to call them night guards, but whether you call them a mouth guard, an oral appliance, or a night guard, what I'm talking about are custom-made acrylic appliances that is thought to keep you from grinding. I'm not talking about the rubber do-it-yourself football type of mouth guards that a lot of you guys are buying at Walgreens or somewhere like the Boil and Bites. These are a terrible idea. Here's why. They make it worse. So if you're putting something like that rubber in your mouth, you're giving the teeth something to grind and rub against. So when I'm talking about a mouth guard or a night guard, I'm definitely talking about a custom-made appliance, okay? So this topic really gets me fired up because now as a practitioner, I see how detrimental these mouth guards can be. But I also share with my clients my experience when I was in the dental practice. Now, slow your roll, because I'm not talking about all dental practices. I'm just talking about the ones that I was familiar with in 15 years of doing dental hygiene, but I call it the dark side of dentistry because now knowing what I know as an orofacial myofunctional therapist, it makes me so frustrated on what might be going on in your dental practice. So what I would see as a hygienist is I saw the night guard or the mouth guard as a revenue builder. And like I said, knowing what I know now is super frustrating because I would have doctors or perhaps the office manager when we would be in a staff meeting and they would say, hey, numbers are down. We're lacking in our revenue production by whatever thousands of dollars. And I always thought it was interesting that we would have that conversation and then lo and behold, everybody was grinding their teeth. Everybody that came in needed a night guard, okay? And so once I had gotten into myofunctional therapy and I was also still doing some hygiene, remember, I only did hygiene for 2 years while I did myo because I finally had to leave dentistry because I could not stand the hypocrisy, I could not stand the closed-mindedness, and I could not stand the silo mentality that I was experiencing that doctors were all about the dental work, but they weren't about the health of the client. They would make a night guard for a client and never ask about it again. They would make a snoring appliance for a client, never ask about it again. So I'm getting a little bit off into the weeds, but my point is, I get very suspicious when I meet so many people who have a night guard. And oftentimes doctors are prescribing those. They're highly expensive, but oftentimes they're prescribing those because they might see some evidence of grinding. We're going to talk about that here in a minute. But it might also just be that they don't know what else to do for you. So, if you're having ear pain, maybe you're grinding. Let's put you in a night guard. You're having this problem, maybe a night guard. You're having this problem. Definitely, let's try a night guard. Sometimes they're just taking a shot in the dark. So that has been my experience with them. So the question that I'm talking about today is, can mouth guards make sleep apnea worse? And the fun fact is, now I can't give credit to which one of my mentors said this, but specifically, this is a concept that's known and accepted in the airway world in which I live. And we talk about it repeatedly in education, but night guards or mouth guards make sleep apnea 100% worse 50% of the time. So wrap your mind around that. What am I saying there? So I'm not saying that there's not a use for a night guard. Maybe a tiny one. I don't know. I haven't thought about it yet. But what I'm saying is they don't help get to the root of the problem. And quite frankly, they are sold at a very premium price without digging any deeper. So in this episode, let's unpack that. We're going to talk about if mouth guards worsen sleep apnea. All right, so soapbox item number 1. The problem with mouth guards, and perhaps why they might worsen sleep apnea, is they don't explore why you're grinding. If that's the reason that your doctor is prescribing it for you, it doesn't help understand why you're doing it. That's my job. I help look for the root, or the root of the root of the root of the root, okay? So there's a couple schools of thought when it comes to grinding. First of all, my friend, I will tell you it's not normal. I don't care who tells you that it is not normal. It's indicative of an airway crisis, okay? So there's really 2 schools of thought when it comes to grinding. So the first school of thought is that your body is grinding as a state of being in a constant arousal. So if we keep Johnny just kind of on the edge of deep sleep, but not so much because, he likes to suffocate and gag himself. So we're going to just barely keep him aroused. That's one of the thoughts. So that the body is just keeping you from going into that super deep restorative sleep that you need, my friend. The other thought is that the sound happens by happenstance. So it just happens when the jaw is jutting forward. Many people jut the jaw forward and they tip the chin back, which, my friend, we call self-CPR for a reason. If you were doing CPR on somebody, one of the first things that you do is tilt that chin to open the airway. So that happens. So either way, whatever the reason of that grinding is, we know that it's not good, okay? So that's my first soapbox issue. My second one is that many doctors sell you an appliance to stop the grinding. But it doesn't stop the grinding, my friend. It records the crime, okay? And quite often, it exacerbates it. You've put something in there now and your mouth just grinds against it. I always tell my clients, it does not stop the crime. It records it. Take a look at your night guard, okay? Take a look at it and see how chewed up it is. You're still grinding. My sweet baby girl used to go through a couple of these a year to the tune of $400 to $800 a piece. That's a huge revenue builder, and it wasn't solving anything. Now, the other thing, I did some research on this, did some digging, and another issue that I found is that these occlusal appliances, so some call them a flat plane night guard. And when I was talking about the custom-made acrylic night guard, that's what I'm meaning, is it's only fitted on one side, okay? If you have it fitted on both sides, it gives you something to grind against. You can engage your teeth together. But if it's got that smooth, flat, plain side, it's going to keep you propped open, essentially. So I read that these flat, plain night guards encourage the lower jaw to fall back at night, which increases the rate of snoring and to some degree of life-threatening sleep apnea by 40%. So that's pretty significant. It went on to say that these night guards should never be used by a patient who snores or has sleep apnea. Interestingly enough. Now, it also said that patients with TMD issues, which many of you come to me with, you guys should also not wear night guards. It went on to say that any appliance that encourages the lower jaw to fall back at night, to be back at night, if the TMJ problem is there, these people with these issues should not be using it. So anybody who has clicking when they open or close potentially should not be using these. So now take that for whatever it's worth. I think it's worth thinking about, because that's another thing. Thousands of people that I have helped I have met people who have spent $40,000 and $50,000 trying to fix their jaw joint because it's damn miserable all the time. No fun. Soapbox item number 4. 80 to 90% of people who have some level of sleep disordered breathing are undiagnosed. Let me say that again for the people in the back. 80 to 90% of people who have some level of sleep disordered breathing, it's undiagnosed. So when there are over 3 million night guards that are sold annually, and these doctors don't screen many of them, I'm not saying all of them, for those who don't screen further for sleep disordered breathing, that to me seems like there's a big disconnect. Again, it kind of goes back to that silo mentality. Hey, let's create this night guard for our clients, but let's never ask about it again. Just my experience. But again, when I was in hygiene, the doctors never asked. I would have to bring it up, or it was just one of those things. Oftentimes, even us as hygienists, it was such old hat that we never even paid attention. We never asked if it even helped. And I think that's a tricky thing there too. Soapbox issue number 5 is decreased tongue space. So when you have somebody who has a small mouth and you put something in there that's the size of a daggone shoe, what's that gonna do? How's that gonna help? It feels like you're trying to sleep with a wad of big league chew in there. That's not solving any problems. I have many clients who say, Carmen, I have spent hundreds on them. They've remade me, they've made different styles, and I just can't figure it out. And I look in their mouth and they don't hardly have room for the tongue, let alone an appliance. Okay, and then last thing. So my last issue, number 6, I'll call it. So you get a night guard, and then what? Do you have a sleep study with the oral appliance to make sure that you're getting better? Many people who I work with actually report that their AHI, which is their apnea-hypopnea index, is part of their sleep apnea diagnosis. Many people, it gets worse, and many start snoring. So I know it's totally anecdotal, but I am seeing that in my practice. The other thing that I'm seeing a huge uptick in my practice is doctors who have treated a client for like snoring. They've given them a snoring device, something like that. Or they've done an expansion device, and they've got some sort of appliance in there, and things are getting worse. It's interesting that then, and only then, those doctors are referring out to me saying, hey, can you fix this problem? When quite honestly, I should have been part of the journey in the very beginning. So what do you do if you have an appliance or if you've been told to get one? I think the most important thing is I can't really advise you on your particular case if I don't know anything about you, but by and large, what I tell clients that I'm meeting is, let's see what's going on. If I have a client who clearly is grinding, they might need some airway ortho work, which is more than just a night guard, okay? Airway orthodontics, I'm not going to get into it here. I've got plenty of resources on my website about it. But that helps structurally fix the problem so you can enlarge that airway so you can have more air. But if somebody has a tongue tie, like, why don't we pick the low-hanging fruit? Why don't we see what's going on with you before you spend those hundreds of dollars on an appliance? Not saying you won't need it, but a lot of the time, most of my clients don't get them. They choose to wait. I have a lot of clients who will say, hey, Carmen, should I stop wearing my appliance? And while I am never going to say, hey, stop wearing your appliance, I am more interested in educating you and having a conversation with you about the possibilities of A, B, and C. You can take that to your doctor. You can make decisions for yourself like a big kid. I myself used to have one, and I got rid of it in a heartbeat. I sleep like a baby. I have many, many clients who ditch them. So don't buy it. So don't buy it right now if you're thinking that maybe you have concerns, or if you have sleep apnea, if you have sleep disordered breathing, that kind of stuff. Let's do an exam so that we know a little bit more, and then we can go from there. So I hope that was helpful. If you know somebody who has a mouth guard. If you know somebody who has sleep apnea and perhaps they have not heard of me or the therapy that I provide, share this with them, because sometimes it's this little piece of information that really just tips over that one domino where we change their entire life. So that's it for this episode, you guys. I will be back next time with another hot topic. Bye for now.